You are watching a recording of the Association of Municipalities Ontario webinar, Appointio Appointment Booking Solutions, presented by eSolutions Group.
Appointio. I want to just take a moment to mention that we have some questions that have been pre-submitted, and I will address those at the end of the presentation. Before I jump in, let me introduce you or refresh your knowledge about our company, eSolutions Group. eSolutions is part of the larger global firm GHD and has been providing digital solutions for over 20 years. We have a dedicated staff of more than 100 people and have many years of experience working with municipal clients like yourself. And as you grow, we continue to grow and add services to our portfolio to meet your changing needs. As many of you might be aware, Sourcewell is a self-funded government organization that has served more than 50,000 public and nonprofit entities since 1978, helping them to become more efficient through streamlined purchasing and other services. Now, eSolutions Group was awarded a contract to provide public administration software through the Sourcewell agreement. This means that Sourcewell members can acquire any of our eSolutions Group products without requiring them to go through the RFP process. This membership is free to public agencies, and if you are not a member, I have provided a link here for you to register. So with all that being said, let's now discuss our Appointio application. Appointio is an online-based appointment booking system, helping to streamline your scheduling needs. Of course, this is more important now more than ever. With COVID-19, you need to ensure that you don't have too many people entering your buildings at once, and Appointio can definitely help with this. The Brantford Community Healthcare System, or BCHS, is an example of one of Appointio's users. They needed a customized, user-friendly application that would allow patients to book COVID-19 testing appointments online. To complicate matters, the application needed to be up and running quickly and be secure enough to protect the personal health information of individuals. Appointio was up and running quickly and became a vital component for BCHS in managing COVID-19 testing appointments. Appointio was able to handle the high volume of appointments without interruption, and BCHS staff had no trouble using the system to manage those appointments. Here's a quotation from one of our happy users. Within the first 3 days of launching, more than 1,500 appointments were booked seamlessly. Thanks to Appointio, our teams have more time to focus on testing and caring for the people we serve. So now I'm going to go through a quick product demonstration to show you Appointio in action. So this is the page on the BCHS website with instructions pertaining to appointment booking. A visitor would simply read through the instructions, eventually coming down to find the link to the online self-booking tool. By clicking on the link, the individual can now select when they want to book their appointments. They have a few options here: daytime, evening, or weekend appointments. For the purpose of the demonstration, I'm going to click on the link to the daytime appointments. The calendar for the appointment booking schedule is now presented. From here, I can select from a number of dates that are available. I'm going to click on March 3rd, that we have 80 slots available. Once I drill down to the date, I can further have a look and see all of the time slots that are available for appointment booking. Once I find the time slot that meets my schedule, I would simply click on the link and provide the required information. So in this instance, the individual's name, last name, email, phone number, and referral source is required. Wherever you see an asterisk, this information is necessary to complete the appointment booking process. The individual, after clicking the button stating book now, will have successfully booked their appointment and will see the following screen. They will also receive an email in their inbox with their appointment reference number, detailed information, for example, what they have to bring to their appointment, as well as the address of their appointment. And they will also be presented with a link to either reschedule their appointment or cancel their appointment if necessary. Should they decide to cancel, they would simply click on the click here button. This will take you to the screen where you will be asked to verify or confirm whether you want to cancel that appointment, and I'll do so in this case. And then again, you will further receive a statement stating that you have successfully canceled the appointment, as well as an email confirming this cancellation. So users of our system can customize email responses and also from the backend pull reports based on timeline and type of appointment. So in this example, I have selected a librarian booking appointment and I've selected my date range. I would simply generate the report and pull up all the individuals who have booked an appointment at this particular time. This can be done for all of the different types of appointments you are scheduling in Appointio. At this point, I will return back to our presentation. And close off our discussion by stating that setting up Appointio is very easy, and we can have you up and running in very little time. And at this point, I would like to ask my moderator to join me with any questions that have been sent beforehand or during the presentation, and I will answer them for you. Welcome, Derek.
Thanks so much, Nancy. So the first question that we had submitted is, what is the advantage of using Appointio over a typical calendar, for example, Microsoft Outlook?
Because Appointio has both a front end for your citizens and a back end for you, it eliminates a lot of unnecessary administration. The public can book their own appointments directly into the calendar. You don't have to do that for them. They can also reschedule or cancel that appointment at their own discretion. Appointio calendars can also be shared with multiple people. So which appointments are booked isn't dependent on who put that appointment into the calendar. And furthermore, automated email notifications for the person booking the appointment is also a huge factor. Does that answer your question?
Yeah, I think that's great. We had another question here. So we've seen cases where people use software to book COVID vaccines, and the website goes down because too many people are trying to book. How does Appointio prevent this?
Great question. We have done extensive surge and threshold testing to ensure that Appointio can handle significant volumes. Our testing has showed the system could handle upwards of 25,000 people accessing the site in the exact same second with no issues.
That's great. Another question here. Can we set up, can we set it up so people aren't overlapping and appointments have time in between them, or only back-to-back bookings?
Great question. The answer is yes, you can set up appointments however you like. If you need time in between to ensure you don't have too many people in the building, you can set it up that way for sure. You can also block out scheduled time, for example, for lunch breaks, holidays, or anything else you need, all on your own in the back end at any time.
Great. And I think this is a really applicable question to this next one here. What do we do for people who can't book online and have to call in? How does the system help?
Well, what's great about Appointio is the live availability of appointment times. So when people call in, your staff on the phone can book through the system on their behalf. And those appointment times are the same as they'd see online. So once it's booked over the phone, you don't have to worry about someone online booking the same time slot or keeping appointments separate. It's all managed in one place. If the person calling on the phone does have an email address, you can use that email so that they still get all the notifications with the appointment time, location, reminders, and the options to cancel or reschedule.
Okay, great. Moving along here, how is data stored to to protect sensitive information?
Great question. So we use bank grade data encryption to protect the data on both ends. Everything on the website everything from the website to the system uses SSL encryption to protect the data. We also encrypt the database information so that if the database were accessed, the information appears as gibberish and no confidential information can be matched to a user.
Great. I think that's really important for anybody here. Can we use this in other departments for non-COVID appointments? Does that require a separate duplicate system?
You can absolutely use one Appointio system for everything and multiple departments. Separate calendars within the backend can be created for, as you mentioned, perhaps maybe different departments, functions, locations, etc. We have municipalities using Appointio for a variety of different applications. Some of those are marriage licenses, COVID testing, even fitness center appointments or more. It really is, it's all encompassing, and you can, again, use it amongst various departments.
Great, and I think this is another great question here. It kind of ties into the last one is, how many users can use Appointio, and is there a limit on the number of calendars that can be created?
There is no limit, so Appointio allows for unlimited users and unlimited booking calendars.
And the last one here is talking about costs and what does it cost to get up and running with Appointio. And I know if anybody's looking for an individual cost quote, you can reach out to Nancy. Her contact information here is on the last screen, and she'll be able to provide an individual quote and answer any additional questions that you may have. Over to you, Nancy.
So it looks like this is the end of our presentation. Thank you very much, Derek, and thank you to everyone who attended today. We look forward to hearing from you, and we hope that Appointio can help you with your appointment booking needs. Thank you again, and have a great day.